So our first presenter today is Dr. Gloria Gutman, and she has received the Recognition Award for Excellence in Student Mentoring from the Canadian Association on Gerontology. Dr. Gutman developed the Gerontology Research Center and the Department of Gerontology at Simon Fraser University, and was the director of both from 1982 until 2005, and she is still employed at Simon Fraser University. She was the 6th president of our organization, the Canadian Association on Gerontology, is a past president of the International Association of Gerontology and Geriatrics, and is a member of the International Network for the Prevention of Elder Abuse. Her awards and honors are many, including an honorary doctorate from Western University, the Queen Elizabeth II Diamond Jubilee Medal, the Order of British Columbia, and the Order of Canada for her work as an international authority in the field of gerontology. We're very honored to have Dr. Gutman be part of our webinar series, and the title of her talk today is Mentoring, Raising Awareness, and Researching LGBT+ Elder Abuse in Canada. Thank you very much, Dr. Gutman, for joining us, and feel free to begin your webinar.
Thank you. Well, I don't know if everybody is aware, but today is World Elder Abuse Awareness Day, and it's really appropriate for us here in Canada to be celebrating or commemorating this day, because in fact, the day originated with us. It was Elizabeth Podnick who phoned me at 6 o'clock one morning and said, I think we should have a World Elder Abuse Awareness Day. I said, good idea, Elizabeth. You woke me up early, but I think it's a good idea. We took it back to the board of the International Network for Prevention of Elder Abuse. And it took us, we began to offer programs on June 15th every year. And about 6 years later, and much lobbying later, the UN picked it up and made it an official day. But so I really, have a good feeling about being able to talk to you today on this June 15th. And that also led to the choice of what I wanted to talk about, because I want to begin by telling you about a really unique mentoring program. Before we do, we probably should say a little bit about mistreatment of older adults, which is the definition that we used, one that was developed in Canada by the NICE people, of which I was part of that group. So, the national program that was looking at older people and care of the elderly. Now, generally, there are 5 types of abuse that are internationally agreed on. So physical, the emotional, psychological, financial abuse, sexual abuse, and also neglect. Some jurisdictions like British Columbia include self-neglect, but not all do. For those of you who are not familiar with elder abuse, I just want to point out that it occurs both in private households and in institutional settings. And as this slide indicates, the impact is much beyond the actual event. And particularly physical abuse can be very serious for older people, causing them to fall, to have trauma, and to have different kinds of injuries based on how frail the individual might be. There's also the loss of income or assets. With an older person, they don't have the same time as a younger person to make back their losses, their financial losses. And there is data showing that the stress of abuse leads to earlier mortality. So we also want to think a little bit about the issue of LGBT abuse and why this is something to look at. We know that there are a number of risk factors for elder abuse, and when you look at the LGBT community, they're 3 times more likely to live alone. They report high rates of loneliness and isolation. If they have children, the children are less likely to be supportive. And some of the LGBT couples have had experience with various forms of trauma over a lifetime, and they're more likely to have abused drugs and alcohol, which are known risk factors for elder abuse. So, but there's very little research that has been conducted with respect to elder abuse in the LGBT community. So there's this idea that they should be more at risk, but there hasn't been up to now, and I'm going to tell you about some of our exciting data, but there haven't been the studies and the numbers to support it. We should note that with respect to LGBT older adults, they are often described as an invisible population, both within the LGBT community and in the broader community. And part of this invisibility is due to a lifetime of stigma and neglect. And plus, many of those who are old now lived through the days when being lesbian or gay or trans was considered a mental aberration or a crime. It's a long time for some of those people to have lived through stress and discrimination, very different than today's climate, where people in the younger generations march in pride parades, where we celebrate Pride Week or Pride Month, and where people in the younger generation will be quite happy to call themselves queer or to use some of the other acronyms. Our experience with older people is that they just prefer to be called LGBT rather than the queer, which for some of them was a pejorative that was thrown at them when they were younger. So the groups I want to tell you about are this group, Quirky, who are a group of older queer creative writers. They're activists, arts activists, they call themselves. And they range in age from 60 to 84, or at least they did at the time we put them together with a youth group. And these are young people who identify as LGBT. And the two groups had worked together briefly on a couple of projects, but mostly in the arts. And what our project did was to bring them together to address the issue of elder abuse and to create some materials, some Canadian materials that we could use to raise awareness about elder abuse in the LGBTQ community in Canada, which did not exist when we began this project, which was in 2015. And so we brought these two groups together, and the we consisted of 3 academics, myself, who had some background in elder abuse, my colleague Jen Marchbank from the Gender and Women's Studies program at SFU, and also Claire Robson, who is from that same department at SFU, but she is a writer and she had been a mentor together with Jen in working with these two groups before. So it was a very happy marriage that came about between the academics and these two arts activist groups. So that's, and what really happened is that we all three mentored each other. So I was exposed to these wonderful two groups, which I did not know before. The queer youth had a chance to work with elders, and as you see on this slide, it says many don't know queer elders or have had any queer or any elders in their lives, because if they've been disconnected with family, they don't have grandparents of their own that will love them and mentor them. And in the case of the older people, the other group, they are at risk of being considered pedophiles if they do interact with young people. So this was a unique opportunity, these two groups coming together to address a topic that they knew nothing about when we started. So neither group had done anything in elder abuse. And so the first thing was for us as academics to direct them to where they could find information and to learn about it. And the another thing about this particular project was that we had a person from the arts community who knew how to make films and who knew how to work within this idea of arts activism, and who taught the young people particularly some skills. So they learned how to make films and how to do the kinds of posters that we ended up coming up with. So the output from this project was 3 short videos and some posters with fact sheets on the back. And this will show you how creative they were. And it was their idea that, and think about it, this was 2015, before it was the common thing to talk about intersectionality. But what they came up with was to put on the posters the fact that people who are in the LGBT community are more than just their sexuality. We need to remember that they do other things, they have other interests, and this is only one of their particular characteristics. And on the back of each of these posters, it talks about what the different types of abuse are, who commits them, and it also at the bottom, you will see that it gives them information on where to go if they need to report abuse either of themselves or somebody else. So these were contact information, particularly the Seniors Abuse and Information Line is an important resource within British Columbia for people who are concerned about elder abuse. So in the original project, I went out to communities in the 5 health authorities in British Columbia, together with one person from the Quirkies and one person from the youth group, and we presented town hall meetings where we brought together people from the health service provider community and local organizations, because often they did not know each other. So that was part of our mission, was to bring them together so that they would get some programs going that would be of value. Our materials that you can see on this slide are posted on the SFU Gerontology Research Center's LGBT End of Life Conversations website, and you can download them free of charge and use them. They're available in English, in Chinese, and in Punjabi. And as you see, we've distributed 2,500 posters. Over 1,500 people have seen the materials at town halls and other presentations. And actually, they're being routinely used in the city of Surrey and in Kwantlen University's Care Aid program and at other universities and other places, actually in a number of countries where we have presented. The second project I want to tell you about, we call the Indigo Survivors Project. And it's bringing together, because one of the things we noticed was when we looked at the literature, there was not much to be heard from survivors themselves. It was mostly experts talking about what they thought was happening within the LGBT community. So it was the same research team as with the Raising Awareness Project, with Jen Marchbank and Claire and I together as the three leads on this. But it was a partnership also with Community, which is the BC Center for LGBT advocacy and support. And they partnered specifically with us. We got some money from the Vancouver Foundation to cover some of the costs, and they provided the input of Courtney Deacon-Brader, who's their specialist in seniors programming, and also a trauma counselor, because we were concerned in bringing survivors together to talk about their experience, that if it brought up emotions that made them feel uncomfortable, that there would be a resource to help them with the stress, and to also to bring them, if they wanted to be together, to have an ongoing group. And about half of the 9 that we actually interviewed did form a group, and that's still going on. So these are the missions, healing, to assist the healing of the persons that have experienced and been victimized, some counseling, some peer support. We also had in mind that we were going to produce a book out of this. And Claire took the lead. She is a gifted writer. And so she had in mind, and right from the start, to do these interviews and to combine them, but first to make each into quite a tight narrative. And so she went back and forth with the people we interviewed so that they were happy with what was finally the product of their communications with us. Community will be doing a report. We have provided some training for student RA, so that's another form of mentorship. And in addition, Jen was successful in getting some funding from SSHRC and from the gender program to do a synthesis of the existing literature on LGBT and elder abuse, and we have just submitted that. So in total, we had 9 participants, 2 trans women, 2 gay men, 5 lesbians. And we also interviewed both the counselor and the trauma specialist and the senior specialist. And this is the book. It was published about 2 weeks ago. So the third group of studies I want to tell you about are ones that are using data from the Canadian Longitudinal Study on Aging. These are the 3 PIs on the project. And our idea was to look at elder abuse from a Canadian perspective and through a sexual orientation, gender, identification kinds of lens. So the first study was designed to give us some numbers, prevalence, race, risk factors for elder abuse by SOGI group, The second study, which is we're still in process of writing up, has to do with the perpetrators. And we also did 2 studies during the COVID-19 pandemic, where we used variables that were proxy because there wasn't an elder abuse module included in the COVID-19. And one of those is actually published. So just to remind you, for those who are not familiar with CLSA, it's over 50,000 Canadians between 45 and 85 who are being followed up over probably about a 20-year period, and they're followed up every 3 years. So just to give you the timeline, what you see here is the data collection started in 2011. The first elder abuse module was in follow-up 1, not in the baseline. It was not repeated in follow-up 2, but it will be repeated in follow-up 3. So, but there will be, as you see, a 6-year gap. So the elder abuse module started in 2015, and then you see where the COVID-19 survey was. So it's adapted from the work of the National Initiative for Care of the Elderly of NICE. And just to give you an idea of the questions, see, there were several questions having to do with psychological abuse, several that had to do with physical abuse, several that had to do with financial abuse. And we analyzed data only for those who were 65 and over at follow-up, some 23,000 people, because the elder abuse module was only administered with people who were 65 and over. And these were all community dwelling people who were not cognitively impaired and who were able to communicate in English or French. And we constructed dichotomous variables for the 3 types of elder abuse that are explored in CLSA. So we have a manuscript that has been submitted. We're just waiting for the final approvals to see it in print, we hope in September. The important things to find here is that we have data from CLSA that actually shows higher rates for all of the 3 types of abuse, for psychological, physical, and for financial, rates higher in the LGBT community. So that verifies sort of what the researchers have been saying. But what our study shows that is really interesting and exciting is that there are differences within the LGBT community, with lesbian and bisexual women having a higher rate of psychological abuse than heterosexual women, or of men, whether they are gay or heterosexual. We see the same pattern in the case of financial abuse, but a different pattern when we get to physical abuse. Here it's the gay men who are experiencing more abuse than others in the SOGI groups. So the importance of this particular study is that it really is the first one to give numbers, certainly the first one in Canada, to give numbers about prevalence and to look at the interplay, not just of gender and sexual orientation, but with the variety of other risk factors. So what the findings suggest is that there's divergent risk across the LGBT gender and sexual orientation and elder abuse types. We also found differences between the bivariate and the multivariate regressions. So the bivariate associations, as you can see on this slide, showed higher odds of experiencing psychological, financial, and any type of abuse in the LGBT compared to heterosexuals. But when we did the multivariate, putting all the socio-demographic and emotional and some other variables in there, it was sexual orientation was only a significant predictor of financial abuse. And so coming back to the posters that showed people as having a variety of characteristics, wearing different hats at different times, we think that some of the other variables may be more important in figuring out who's going to be a victim and in trying to make some targeted prevention programs. So in terms of overall implications of the study, we know that there's gaps in reporting. We need to also build capacity and agency within the LGBT community so that they come forward and seek help, because many of them don't really, they've had bad experiences. They don't really trust the healthcare system. But we hope that one of the things that our work will do is to help people to feel more comfortable in going forward and to know where to go forward, where they can get help that will be respectful and that will understand that although LGBT people experience some types of abuse that are different, such as the threat of being outed, because many of them have spent their life in the closet, and they're nervous about going into long-term care because they think they will have to go back in the closet if they've been out. But some of them have never been out, and so have been part of that invisible population all their life. So that's a unique form. There are a couple of other unique forms for this particular community. I will just tease you by telling you that when we look at the perpetrator data, we also see differences between who does what to whom with respect to elder abuse in the LGBT women, men, and with heterosexuals. So thank you. I hope you found this interesting, and please do feel free to contact me if you have questions.
Well, thank you so much, Dr. Gutman, for that interesting overview of some of your innovative work that you're doing in Canada and there in BC, but analyzing data from the elder abuse questions and the CLSA. You covered a lot of ground there. We do maybe just have a couple minutes before moving on to the second presentation. So you're welcome to post questions or comments for Dr. Gutman in the chat. There was a comment about your posters that you put, that they were a really nice visual representation of intersectionality and how you captured so many concepts in a visual way. So that was one comment that was posted about your posters. Any other questions or comments for Dr. Gutman right now? A question around the scope of the data. I think it's talking, Doug, about the CLSA data maybe. So the question is, does the data include elder abuse around the trans population? Now, I'm not sure if he's referring to CLSA or your other work.
The sample of trans individuals was very small. So what we did was to combine them with whatever the gender identity was current and that they were comfortable with. So if a person was a trans man, they would be put in with the LGBT or sorry, with the gay and bisexual men. But the
Okay.
sample was small. So that's why our the acronyms just say gay, bisexual, or lesbian, bisexual, and the T's are not there. So that's
Okay.
the
Yeah.
sample
Okay.
size.
Yeah, great. Thanks for that clarification. That's an issue of the sample size in the database for sure. Yeah. Okay, thank you for that. And you're still welcome to post comments and questions in the chat. Karen, did you have a comment or question?
Yeah, I just have a comment. I just want to share with Dr. Gutman that I began my career at 411 Senior Center, which is a senior service center in Vancouver downtown, for those of you who may not know. I just want to say that I use the material, especially the poster, like we stick it all around the center. It helped to raise the awareness, not only among the LGBT elder population, but also from those who are not from the LGBT elder community. And yeah, I just want to say the poster and the materials are really great resources, and would like to say thank you very much to Dr. Gutman and also her team. Yeah. Mm-hmm.
Thank you. We're about to do another run of those to update some of the numbers on the contact information on the back. So we've just been so delighted with how people have responded to those posters, and like I say, they're being used in a lot of places. So thanks for verifying that.